Fentanyl is one of the most potent synthetic opioid medications developed in the 20th century. It holds significant medical value but poses a severe societal threat due to its widespread misuse. This video explores what fentanyl is, the history of its creation, its medical and non-medical uses, its dangers, and how it affects the human body. Fentanyl is a synthetic opioid used as a powerful pain-relieving medication. It is commonly prescribed for severe pain management, including pain associated with cancer and post-surgical recovery. Fentanyl is approximately 50 to 100 times stronger than morphine, making it highly effective but also extremely dangerous when misused. Chemically, fentanyl is a derivative of phenylpiperidine and works by binding to opioid receptors in the brain and central nervous system. This binding blocks pain signals but can also induce euphoria, respiratory depression, and dependence. Fentanyl was developed in 1960 by Belgian chemist Paul Janssen, founder of Janssen Pharmaceutica. His goal was to create a new drug that provided powerful pain relief with a faster onset of action and fewer side effects compared to existing opioids. Initially, fentanyl was primarily used in medical settings, particularly in surgery as part of general anesthesia. In 1968, Janssen introduced the first commercial form of fentanyl under the name Sublimase, which was administered by injection to control severe pain. CES associated with this powerful substance. During its early decades, fentanyl was exclusively used for medical purposes. It was administered in hospital settings, mainly for pain relief during surgeries, chronic pain management, and emergency applications. Fentanyl became a preferred choice for anesthesiologists due to its potency and rapid action. Patients with terminal illnesses, such as cancer, were prescribed fentanyl in transdermal patch form for long-lasting pain relief. Injectable fentanyl was also used to manage pain in trauma and other critical conditions. By the 1990s, fentanyl became available in various modified forms, including lozenges, nasal sprays, and oral dissolvable tablets. Fentanyl is approximately 50 to 100 times stronger than morphine. This means that a dose of fentanyl as small as a few micrograms can be equivalent to tens of milligrams of morphine. Its exceptional strength makes it suitable for cases where standard opioids are ineffective but significantly increases the risk of overdose and death. Despite its medical applications, fentanyl has gained a grim reputation as a substance of abuse. The availability of synthetic fentanyl on the black market has contributed to an opioid addiction crisis, particularly in the United States and Canada. Illegally produced fentanyl is often mixed with other drugs such as heroin or cocaine to enhance their effects. This misuse is dangerous because users are often unaware of the exact potency. Fentanyl leads to rapid dependence. Those who abuse it often develop a tolerance, forcing them to increase the dose, which heightens the risk of overdose. Fentanyl is extremely dangerous because even minimal amounts can cause severe side effects or death. The main risks include respiratory depression, its most significant danger, as it suppresses the brain's respiratory center, which can lead to breathing cessation. The potency of fentanyl means that a dose smaller than a pinhead can be lethal. Physical effects include euphoria, sedation, decreased blood pressure, slowed heart rate, nausea, and vomiting. Psychological effects include the development of severe dependence and withdrawal symptoms such as anxiety, depression, and insomnia. Fentanyl exemplifies a drug with immense potential for both good and harm. Created to alleviate suffering, it is now at the center of a global opioid crisis. Understanding its history, potency, and dangers is critical for both medical professionals and society. Only through effective regulation and education can we limit its misuse and mitigate the devastating consequences associated.